testimony. I think this is where. So I need to let you know that a lot of this testimony, not only by the device alone. We still advise that you still go ahead with your doctor's prescription. Don't stop your doctor's prescription. So whatever condition you are treating, so this is not a device that will heal you. It will only help your body to heal itself. So don't discard your medication. Continue with your medication. This is a picture of a baby that was treated for weeks somewhere else and was sent to us with bronchial pneumonia. He couldn't sleep, having difficulty in breathing. Just with 2 days therapy, the third day, they were happy that we said they should go. I haven't been in the hospital, hasn't been in one hospital for about 2 weeks with no improvement. So this is a diabetic foot that has been treated for months. The foot was getting gangrenous, and then here at the base. Now, the first treatment, the patient said the foot is no more feeling heavy. He could bend it easily now. It could enter the shoe. Just first treatment. The second day, it felt better. And by the time we conclude, the wound is healing fast, very fast, so we'll be able to surgery. And well, she was afraid of the surgery. We placed her on this device, and within 5 days, the noise in the air disappeared. No more noise in the air, which has been there for about 2 years. So this is one of our patients on stroke treatment. This patient came right away from, I'm in Mina, Niger State, came from Abuja, and he said there is no center in Abuja where they could treat. And we have to admit for 2 weeks. With these 2 weeks, this woman can walk with a walking stick. Before, it was on wheelchair, and she's doing perfectly well now. And another patient also from Abuja too, that for 2 weeks treatment, he could not stand up, he could walk now. And you won't believe it that they now come from Abuja every other day for follow-up treatment. Just to, and Abuja to Mina is about 2 hours drive. So that shows their faith and that this is really working. I've been advising them to get the device, which they said they are gathering money for. I also advise them not to buy fake so that they will not think a 35,000 naira is the same thing as a 27,000 naira device. So, and they are happy to come. This is a patient with, postoperative sepsis. He has been on this for about 1.5 months. And somebody referred her, and the next day, there's no more pain again. No more pain. He couldn't sleep because of pain. Just one treatment, the pain is gone. And she's happy. This patient has had a series of operations. He had an implant. The implant was removed. Like we said, we don't use it on patient that has implant. So this implant has been removed. He's on treatment he has stiff leg. This leg cannot bend like this before. It's just straight. He has been on treatment for about 2.5 years. 2.5 years. Now he could bend the leg. And even for about, before I saw him, for about 2 months, the muscles were always contracting. You will see the muscle contracting. And I told him, this is dehydration. All you need to do is just take your charged water. And within a week, he was able to bend the leg like this. Bend the leg. He was so happy. Even the mother, sang praises of joy that the son will walk again. So This is also patient with sepsis post-operatively, and they told the patient that they want to, reoperate and remove the infected stitches. So he said he doesn't want operation. So we started, and it has healed now. These are patients with postoperative keloid. The keloid is swelling that is happening at the operation site or injury site. It has been itching for weeks, and we send her for Iteracare, and the next day, no more itching. The patient has been applying all sorts of medications, injections, but it's always itching. When you inject, the injection will take some time to even spread to the, but within a day, the next day, no more itching. And this is a picture of after 5 days. The swelling is disappearing gradually. So this is another keloid, that has been itching for about 4 months. And just next day of treatment, no more itching. And once there's no more itching, this swelling will disappear gradually to dissolve, and then you have a normal skin. So he's so happy that no itching disturbing her sleep, because most times, the itching is so terrible that they don't sleep well. But just one therapy, this itching has gone. This is a child with skin sepsis, that skin infection, has been on so many medications for close to about a month. Just within 2 days, the swelling is drying up. He's a patient that was sent to us, just for the Iteracare treatment. This is a cancer of the breast. He has not been sleeping for about 2 weeks. He has not been able to eat for about 2 weeks. And you won't believe it. We did it first day. The second day, she was smiling. She was eating. She was happy. So he said, okay, you have to go back to your center, that since the center has promised to remove the breast, you can go ahead and do what your doctor says. And maybe after the treatment, if you still, you can still see us for more therapy. So like we said, this device does not cure cancer. It helps to reduce the size. It also helps to reduce the pain. And like this patient now, the pain was like 80%. He was happy, he was able to eat. And that's just it. Well, this patient has swelling in the neck. You can see the swelling here. Anytime he presses it, something like stone will come out into the mouth. It's having stones in the salivary glands. And with treatment for about a week, he was okay. So please, this is how to hold this device so that it doesn't fall from you. Somebody was charging his water and this thing fell into the water. So you could be absent-minded, especially for the elderly. So hold it well and preserve your device. This is a patient with herpes infection, that is infection of the face, and he has been on treatment somewhere for about 2 to 3 weeks, and he's always in pain, couldn't open the eyes, and he was referred to us, and the next day he was able to open the eye, and the pain was like 95% gone. 95% gone. And the third day we discharged the patient to go back to his doctor. So This is a patient with severe breast pain. The left nipple was retracted. This nipple was retracted and it's having severe pains in the two breasts, which has been on for about 2 months. And within 5 days, the pain gone completely and the nipple back to normal shape, no more retraction. So this is a patient with, burns, scars, with itching, with drawing, with pains. And within just 3 days treatment, the itching has gone, the pulling of the face has gone, and no more. And once itching is stopped, then the scar will start going gradually. This is a male breast swelling, and which resolved within 5 days. This is a varicose vein, and which is still on treatment, but it's reducing fast. This lady has a swelling the floor of the mouth. This has been there for about, I think, 8 months. It was advised of surgery, but our people are always afraid of surgery. We want an alternative treatment, and which we started on Iteracare. The swelling has reduced by about 60% so far now. So this is a patient also who is afraid of surgery. That is swelling of the scrotum, water inside it, which we call hydrocele, and is afraid of surgery. He believes that if they operate the scrotum, he might not be able to perform his functions. So we started on this. The last time I called him, he said, "Doctor, the thing is going down fast, that he's happy." So that's hydrocele. This is a patient with swelling in the throat. Has been on treatment for about 2 weeks that the ENT surgeons want to remove surgically. I think he also was afraid of surgery and came, said, "Okay, no problem, continue with your medications. Let's use this. If it doesn't resolve in a week, we need to go back for the surgery." Within 2 days, the day we saw him, he couldn't even open the mouth. We have to force it to open. Second day, the swelling has disappeared, just minimal swelling. He could smile, he could swallow easily without pain. Just 2 days. Imagine what will happen if he's on therapy for 5 days. Just okay, third day, don't worry, you are okay. Go ahead with your medications, no need for surgery again. So I will also want to go to show some wounds. In case you are eating, maybe you might be nauseated or you're afraid of looking at bad wounds. So please, you can turn your head somewhere else or just listen to the voice so that we don't want you to vomit. So this is swelling and it's on therapy and it's doing very well. It's a chronic wound for some years now, and this leg is swollen. And within just a week treatment, the swelling has reduced drastically. The patient cannot walk; it's always on wheelchair. Here he can walk with clutches. He can walk. So that's the power of this device. So this is a patient with diabetic wound following an accident with a fracture. But because we have to, it's an open wound, there's also a fracture, we have to terahertz it with care. And you could see a lot of dead tissues, you could see the muscle here. And then it's not an everyday treatment. We just continue with the dressing, continue with the medications, and then you can see good granulation tissue on the muscle. So this will heal gradually, and if it's taking a longer time, you can advise on plastic surgery. But at least the wound is not deteriorating, it's improving. the muscle has been covered with a layer. That's why it is red like this. And they are so happy that this hand will not go off. The diabetic patient, diabetic patient, their wounds could be difficult to treat. Let me tell you that this treatment is just a 3 weeks treatment. 3 weeks treatment. And a lot of good granulation tissue has been formed. So this is another naughty wound, gangrenous wound. He ran from another hospital because they said that leg will be amputated, and somebody said he should come to us. And we treated. He has a fracture, so we have to be treating it 2 times a week because of the fracture, and then because of the open wound. And within the 3rd week, you can see this bad wound has become like this. And this patient was discharged home, wound healed. The last time he called us, he said there's no more open wound. It's not from this town, I think it's from Kwara State. Came right away from Kwara State to Niger State to take treatment. He ran because it was advised that the leg would be amputated. So that's just the beauty of this product. Like I keep saying, please beware of imitations. Buy directly from source. Buy from the person that invited you. Don't go and buy 35,000 naira equipment. I think it will work like 27,000, 270,000 device. So this is me with the device. You can see the logo here. And this logo is also at this side. So, I also have my own testimony because, like I said, I use it daily. We in the medical line were exposed to a lot of what you people call kata, which once you use the device on it, within 2 days it goes. I once had a toothache that I decided not even to take. Toothache was because of the tooth prick from the tooth prick stick. I decided not to use anything, just Terahertz, and this pain disappeared the next day. We have a lot of patients, close to about 20 with renal stones, and they are doing fantastically well. I even had the small stones, and I use it. We also use a regime with our renal stones, which is also working fast. So if you have cause you need to treat renal stone, you can always talk to us. We'll let you know the regime. It's working briefly. We have over about 20 cases. People come from about 2 hours drive, and they are doing well. The post-operative patient, especially CS, wow, I would say wow, it's fantastic. By the 4th day, we just place them on a short tera on the wound, and the pain just disappear suddenly. No more pains at all. They could even run, and they could jump, they could run, and we just tell them, okay, do your Iteracare treatment for 3 months. You come from home and do it, and we just use level 1 for them, and they are doing fantastically well. Some of them, even who had operation in 1 or 2 places before, they will tell you, say, what doctor, what is the new technology? What is the new technology we are using? It's just new in Nigeria, and also new in the world. It's less than 1 year all over the world. And the swelling will go down rapidly, no itching, no keloid formation, and pain is just disappear. Skin tags, it will break off skin tags within 3 to 5 days, depending on the how thick it is. That's how marvelous it will just dry it off and the thing will just go off. So we've used it on a lot of patients that with fatty liver. You know, I haven't been diagnosed with fatty liver from especially hepatitis from ultrasound, and the swelling will reduce. We've seen patients with glaucoma that comes as far as Kogi State, you know, for treatment. And within 2 weeks, they can say they are now seeing you gradually, you know, they're able to see you. So that's how marvelous the device is. Chronic wounds, we've shown you some of them. Sickle cell patients, SSAC, that, you know, the pace will just go within 10 minutes. And it looks like a miracle. Patient with priapism, that is, that the sickle cell, that the penis will just stand up and refuse to go down. Just with this device, you know, within 10 minutes, this penis will go down. In some cases, they will even need to do surgical operation to make it down because it's very painful. It will refuse to come down. But within 5 to 15 minutes, this device, a lot of people with chronic catarrh, you know, the one you call chronic catarrh, just within 1 week, you know, they are gone. Menstrual pains is just 5 minutes to 10 minutes, menstrual pain is gone. Ovarian cyst, it will dry the ovarian cyst completely. These are patients we've seen, you know, within 1 week to 2 weeks, the ovarian cyst will dry up. You won't see it again in ultrasound. And migraine, they will just tell you, doctor, it seems as if it's this device that puts the headache there. It has gone. We treated a lot of patients with stroke, and they are doing fantastically well. Facial palsy, we've seen patients with, you know, facial palsy for months, 6 months, 7 months. Physiotherapy, medication, no treatment, just within 3 days. No more facial palsy. It could turn the neck, it could open the mouth, it could smile, it could close the eye. Most of them can't even smile. And they've been on medication for over 6 months, just 3 days treatment, you know. So thank you, everybody. I think I can open I also use it for truncal obesity. I think my trunk something has reduced by about 3 inches in less than 1 month, even though I don't use it every day, but I make sure I take the Terahertz water, and this truncal obesity has reduced. So over to you, Dr. Faith.
Thank you very much, sir, for that great presentation stroke sharing of testimonies. It's like I always tell all of us, it's good that we share to encourage one another. And it's good to share for you to know that this product is working. It's not as if it's them say or somebody is trying to market you or something. And if you've not had first-hand evidence that this device works, how can you actually tell other people about it? And that's why even when we are doing the treatment, I always tell them, do a pre and then do a post, because the results don't lie. So thank you, sir, for taking out time to share. So
hello, can you hear me?
We can hear you.
Yes.
Very good. My name is Dr. Daniels. I'm based in Kaduna. I've had series of results with Iteracare treatment on some of my clients. The first one is a general in the army who had chronic arthritis of almost about 20 years. She had taken all sorts of supplements. She even traveled to US for treatment, but to no avail. And then we had to travel to Abuja. And with just one session of treatment, she could bend both knees. She could not believe it. When she was bending, she said, look, Dr. Daniel, I've never done this for good 20 years. Please. I said, madam, go ahead. She bent down gradually, then went down second time. By the third, I said, madam, go down fully. If you cannot get up, we raise you up. And when she did it, she stood up and said, what? This is unbelievable. And right there and then, she placed order for one piece of the classic Iteracare. Then the other one was just something that happened yesterday. A matron from one of the teaching hospitals, she has been having what I believe was lumbar. Yes, she did an X-ray that showed lumbar spondylosis, and she was really in pain. In fact, according to her, anything that she's getting out of the bed, they have to hold her because immediately she steps on the ground as if she's having shock, on her legs. So she came in yesterday, and I said, okay, madam, let me give you a complimentary treatment. I'm not going to pay for this. And I gave her the complimentary treatment. And when she stood up from the couch, she could not believe it. Say, Dr. Daniel, the pain is gone. The pain is gone. I said, madam, take yourself very well. So this afternoon, she came back. I said, madam, how do you feel? He said she was able to get out of the bed without the husband or people holding her to stand on the ground. So in fact, she was very, very excited about the whole thing, very happy with the whole thing. In fact, we have several testimonies, but these are just the few ones we can share for now.
Thank you very much, sir, for your sharing. Thank you. We appreciate that. So we'll contact you for one-on-one because we need to compile these testimonies so that it can be available to the world. Thank you, sir. So is there any other one that wants to share? Mrs. Taiwo Akinkoye, can you go ahead or mute yourself, please?
Hello, good evening.
Good
Good
evening, ma'am.
evening.
Yeah, my name is Mrs. Taiwo Akinkoye. I think I can start all over again. My name is Taiwo Akinkoye. I work with Top Medical, Terahertz department in Mina. So I have some testimonies to share, even though my director has said almost all. So the first one I have on my list is there was a man that has that strained his back muscle. So he couldn't walk. He was brought into our office. They have to carry him. He couldn't walk by himself. So after the first day, when he finished, he got up himself. I was even calling on his people to come and take him. But he said they should not worry that he can walk now, just after the first day. So the rest days, he was just coming on his own. He was just following up. But he wasn't having that muscle pull again. Who couldn't walk too? She was also carried into the office and placed on the bed. But after the therapy of one day, she got up too. And I was telling her, how do you feel? She said she's feeling better. The next day, she came again on her own, unaided. Then the third one was a palsy girl that suffers palsy. She cannot sit, she cannot walk. So after like a week and a half, we were told that she was trying to walk at home, that she used to stand herself and trying to walk. The mother told her. Then the last time she now came, when we finished, she now sat down. She was trying to place herself well, and I could see she could sit down very well, upright, without bending like that. So we were so happy, and she too was very happy, and the mother was very happy. And a lot of teaching cases, which my director has mentioned. And after like 2-3 days, they are all gone. They are very happy. A lot and lots like them, so that I will not take all our time. So I'm happy for the invention of this device. It's really doing wonderful work on people. Thank you very much.
Thank you very much, Ma, for sharing. We appreciate your sharing. Thank you. Okay, Ronke Abidoye, please go ahead. Can you unmute yourself?
Good evening, ma.
Good evening, ma'am.
Good evening, everyone. My name is Ronke Abidoye, talking from Top Medical, also from the Terahertz office too. So I want to share some testimonies. There are so many testimonies there that I can't even finish, although my director has already finished saying some parts, but I'll still like to say some other ones. I want to share some testimonies with everyone. I was opportune to use the device with stroke patients, even glaucoma, diabetic foot, and even the patient that had dislocation due to motor accident. So on the first issue, the stroke, I noticed for the patient with the stroke, after 2 days therapy, that is, we made it twice in a day, the patient began to move the legs and hand. And it really worked miracle. On the third day, when I was about doing the therapy, he was telling me that he felt a strange movement on the hands and the feet. So I was surprised because unlike before, whenever she wants to place the hand or the leg, she'll use the other hand that is not like having stroke to pull the hand. But fortunately for her, she raised the hand that was down, the stroke end. She used it and she raised it up. So I was so she was even smiling because she noticed a little miracle has happened in her body. So the other patient too with the glaucoma too, the patient told me before, whenever he's coming for the therapy, he always like asks one of the patients around there to take him in or to take him out. So unfortunately for me that day, he just entered and he went directly on the bed that we normally use the device on him, directly there. I was surprised. So it was just like, thank God that he could even see the road to go in, and like that it has never happened to him before. So I thank God for that too. And the patient with the diabetic foot, even if they have mentioned it, although the patient, the foot was very deep and has an open wound on the leg. And she was even asking me the very first day she wanted to start, because I knew her before she came there. So she was now asking me if this therapy, if this device can actually work, that she has spent a lot of money and she has gone to many places. So I had to encourage her, and she had air. So after 3 to 4 days, that's using that device on her foot. So she came back and she told me she noticed that there was an healing up on the wound surface, that can't I see that the wound that is always wet became dry, and that the dark part of the leg was going off, and even the swelling on the leg was already like shrinking, so that she was feeling so unbelievable that this device is really working wonder. Even the patient who had dislocation and was unable to walk properly, even after the setting of the bones, and also having serious waist pain, during the therapy, she continued to be amused by the rapid effect of the device on her. On the next visit, she came with a friend, and do you know what the friend said to me? She said she saw her friend walking step change, and that she no longer lived the way she do before, that she really wanted to know what she was doing. So the friend was really surprised. That is almost 4 to 5 years that she has been limping. So unfortunately for her, that the friend stood upright and was walking fine. So there is also a patient too who could not walk due to wound on the leg, and the wound was not yet healing for some years now. They brought him using a wheelchair on the first day, and the next day I noticed that the wheelchair has gone. The leg that was swollen became shrinking, and the weight was not too much on the leg that he could even lift the leg. I was surprised. And there was a patient too complaining of insomnia. He couldn't sleep, sleepless night. that anytime everyone is awake, that's early in the morning, maybe around 4 or 5, that's when she will be like, she wants to start, try and sleep. So I now like encouraged her. I told her she should be taking the charged water more. So on the next day, the next visit, she told me that she was even still feeling sleepy now, up to now. That people were even trying to wake her up, that she was still dozing off, that this device is really working. So to cut all the long story short, I was like so amused. Even me that I'm doing the therapy for people, I was like, So this is really working, because I had a lot of miracles like that, hearing here and there, every day by day. I begin to like, I had so much joy listening to people telling me how the device has really worked on them after the therapy. So I want to thank these the people that invented this, that and the opportunity also given to me by Top Medical for me to even witness something like this. So it's a really big wonder. I must confess, it's really working wonder. That's all I have to say for now, but it's really much. I can't finish all the people's time.
Thank you very much.
Thank God, sir.
Thank you very much, Ma, for your contributions. Thank you for sharing. So the floor is still open before I crown with mine, and then we can be open for questions. Is there anyone that wants to share?
Yes, I have questions to ask. My name is Victoria.
Sorry, Ma. No, Ma. Questions will come later. I'll let you know when the floor is open.
Thank you so much.
Because we are recording, so we just want to discuss the testimonies first.
Okay, sorry, this testimony just occurred to me now, which I think is we should also share. A patient had a road traffic accident, and for 3 weeks he was carried from one tertiary hospital to another tertiary hospital. And it's from that tertiary hospital, somebody now called him from Abuja that, why don't you go to this hospital? They will solve this pain, because he was crying of pain. When he came to us, imagine somebody coming in, removing his clothes at the reception, not minding those who are there because of pains. And within 5 hours of treatment, he could now lift his hand. He was just smiling that, doctor, this pain has gone. Oh, what miracle that they did it in one tertiary hospital. He was referred to another tertiary hospital, and now referred to us, a small hospital, and now the pain is gone. So he was wondering what miracle. I said the miracle is this device, and the third day we discharged this patient. The main thing was I was having spasms and he was dehydrated. So the device was just helping us to rehydrate him with the charged water, and they also relieve the spasm. And within 3 days, he was discharged. And he has been in the hospitals for about 3 weeks. 3 days discharged. Thank you.
Thank you very much, sir. Mr. Nema sent in his testimony. I think he was talking about a sickle cell patient. So the boy usually uses pillow on his back before sleeping because of pain. But after the first session using the Terahertz, he said for the last 20 days now, the boy has not used pillow. So the boy is much better. He doesn't have issues with his spine any longer. I'm sure that's what he's trying to communicate with us. So I also want to share a testimony from Matron Toyin Bowale. She met an elderly woman. She said she met her the first time. She was very sick, and the woman was actually on Pampers. In fact, she said she wept when she saw her condition because of the sickness. So the person actually had an issue with the heart, congestive cardiac failure, and also had a growth that they suspected to be cancerous. That was early May. So she actually took along with her the device when she went there. And she said the woman felt so relieved that she begged her that she should leave the device for her for a while. So she was using it for 1 week, twice daily in the hospital. And then she was discharged after that. And then she was now asked to be coming from home for her treatment. And before this Itera, she had been on admission in the hospital for over 4 months. Just 1 week of use with Itera, she was discharged. So the Iteracare renewed the cells, and all the treatment that they were giving in the hospital started working speedily. So she was also drinking a lot of energized water. That's the Terahertz charged water. So Iteracare truly works. And she just wants to thank God that she went to see her with the itera device, and it has really performed a lot of wonders. Another person, Matron Regina from Enugu, sent us a testimony that there was a patient that was having uterine prolapse, and the patient was actually bleeding. She was booked for surgery. But after just one treatment with the itera, she discovered that the bleeding had stopped and the patient felt much better and did not need to go through any kind of surgery. And the patient decided to instead do the terahertz treatment instead. Then Mrs. Rebecca Araromi, I don't know if you're available to share, but the ones she shared with me, she sent in some testimonies. Her own personal testimony. She's about 67 years and has not been sleeping deep. Mrs. Rebecca, are you there? Okay. So she's about 67 years.
I'm around.
Okay, so let me allow you to speak. Can you introduce yourself, ma, and just share some of your testimonies?
Okay, thank you. Well, the testimony you are sharing now is an old one, and I think I've shared it before. So, as a punishment for those who are not around that day, I don't think I want to repeat that. Let me tell them new ones. Is that okay?
Go ahead, ma.
Okay, that's nice. Thank you very much. My name is Rebecca Araromi. Just this last week, I went to Mina because I have my wellness center there. And I have just bought one of these devices to introduce to my wellness center there. It has been there, but because I've not been there to teach them. So when I got there, I now told them about it. Unfortunately, I'm not able to get light to do it, and I've not been there for some time. So my generator was not working. A particular woman, she's a retired a doctor in the university there. She heard that I was around. She used to be my client, and she came in, and I was surprised the way she was coming in. She was walking in, just 70 years old, and she was dragging her leg, and she used to be a very smart woman. Then I said, Mom, what is happening? She said, this is it, that she had been in pain since October last year. She had been feeling my absence, this and that. I said, no, don't worry yourself. There's a solution. And then they waited that the light will come. Light didn't come. And then she went to my, and I promised that, okay, I will take the device and come to your house this night if I have somebody to bring me. She said, okay. And then another woman that came, she was waiting, light will come, light did not come. And then 5 o'clock, 6 o'clock, she said, no, she's going to sleep with me because by daybreak now, I might have gone back to Ogun State, so that she's not going to go, she will sleep with me. So around 9 o'clock, we went into the car and went to this other mommy's house. And then when we got there, they put on their own gen, and I used the Iteracare on her. Just about 25-30 minutes. By the time we finished, this woman jumped up, and was walking up and down in the sitting room. Is this a magic? Is this a magic? And the husband is 80 years. He's a retired professor too from that university, dragging leg on the ground. That Baba could not lift up the leg. I said, oh, this thing is hot now. I don't want to spoil it. I've just started. Maybe tomorrow, because I was to leave the second day, I will come. He said, no, they will come to me. I said, okay. By 7 a.m., they were away in my lodge. Then I said, there was no light. They said, what are we going to do? So I have to go to the adjacent house to my office. They have what do they call it now? They have this solar there. So they allowed us. That's how I did for the Baba there. Instantly, the Baba that could not lift up leg was lifting and marching and lifting and marching. In fact, Mama, since that yesterday night that he got away. In fact, when we were treating the husband, she didn't sit down. She said, I don't need to sit down. I'm now whole. Just one treatment. And then they now said, oh, don't take it away. We're going to be coming to the center. We're going to be doing follow-up. We will tell everybody about this.
and things like that. It was wonderful. And then the other woman that slept with me, because we didn't have light, so I have to plead with my neighbor to use their solar. And then we did for that one too. She jumped up because that one had a problem with the chest and the breathing and everything like that. And she felt well. And of course, she said I should send for her own. Immediately she paid. And then when I came back, but before I came back, I just sent to my office in Mina and they sent a device. Then 2 days ago, she called me. She said, "Mommy, everybody in my family, they are all enjoying this device." She told me that she could not breathe well. All those ones are past tense now. And that her child, her daughter, was having problem with the eyes. That after 2 days, that one was saying something is happening. The husband too would say, "Oh yeah, before everybody sleeps, Iteracare." It has been, in fact, the news is, and I'm so happy that I'm hearing from Top Medical because I was in Mina years, so I know about Top Medical. And I know that many people will be hearing about that. And I believe that more miracles will be happening and more people will be getting their own. Now, in my center here, Iteracare is number first approach. When anybody comes. Today, they brought a woman. Yeah, they brought a woman from Ijebubo. And the woman had a mastectomy. And then everything, after about 3 months now, everything came backward. And the hand was swollen. And the woman was in pain. So even come up to my office today was a tug of war. In fact, I pitied the woman. So as they brought in the woman, I just felt I'm going to do this at Iteracare for even free. By the time we took the woman to our therapy room and did Iteracare only once, you will be very surprised at the change the woman saw. So I know that a time is coming. We don't need to be giving testimony. Testimony will be giving itself. So, like me, sometimes I have my doses every night before I sleep because it makes me sleep deep and I wake up refreshed. And it's a very great thing for me. Thank you so much.
Thank you very much, Ma, for sharing.
Thank you, Dr. Akinfoye. Thank you for all that you are doing in Mina. Please go ahead. God will help.
Thank you, madam.
Thank you very much. So, like I said, it's actually a very, very revolutionary device. That's what I always call it. Personally, I have had issues with sleep too, and this device has helped my sleep. I find that I sleep deep, and a lot of testimonies about sleeping issues and the device changing that. So if there's anyone around you that has sleeping issues, this device is going to help. And I also used to have this low back pain, and just 3 days of blowing. In fact, I was actually targeting my midsection, like Dr. Akikoye. I needed to fit into a slim dress, for a wedding. And within 5 days, I actually lost 3 inches around my waistline. And coincidentally, I found out that the lower back pain I've had for months, because bending down, setting up difficult lines and things like this, strained my back. And I found out that up till now, this is like 4 months, the pain is actually gone. And there was also a sickle cell patient that came to the clinic. The girl has been in crisis for like 2 days. And within 15 minutes of blowing, she slept off. But the mother, she's a registered nurse, she was actually shocked. I was like, this is a device that they really need to get. That this is someone that couldn't sleep for the past 2 days. So amazing testimonies. Diabetic neuropathy in my clinic with burning sensation and numbness. Within 10 sessions, there was great improvements. The burning sensation was gone. The person had started feeling his hands and his feet. There was another case of Bell's palsy too. The lady, when she's sleeping, her eyes, one of the eye affected side is wide open. So with 10 days therapy, I found out that her voice was now clearer. And then when she's sleeping, the eyes are started closing. So is it viral ailments? It actually inactivated. Even my son had an issue with cold and flu and sore throat, and he had jam like 2 days later, headaches and all. In fact, by the time we blew the throat and the head, even the sickness knew that it came to the wrong spot. And by the following day, he was much, much better, and he scored very high in his jam to the glory of God. And so many cases of arthritis. There's a barrister, just one session, just one 15 minutes treatment. Up till now, she said the pain is gone. And she even brought her father that is also having a lot of issues with the spine. And even hypertension, some of the patients, they found out that their BP has actually normalized. And there was also a case of diabetes, that the sugar is now controlled less than 100. And so many testimonies. Like we said, if we want to keep talking about testimonies, we will not live here. So we'll try and do some recordings of testimony. There will be a testimonial part 2 because we can't finish all the testimony today.